Hello everyone, how you guys doing? It's me, Dr. Orlando Walters, and what I wanted to talk about today or discuss is how to approach your pain and the proper protocol. And the reason this came to me is because I've been asked questions over the years, and they all seem to be very similar, and primarily individuals who have had back pain, for example. Back pain can be extremely debilitating, and especially if you've never had back pain before, or if it's something that came up as a result of a traumatic injury or an accident or whatever have you. You don't exactly know what it is to go through that injury before. And this also goes for different injuries as well, especially if you've never had it before. And the reason I say this is because if you've never had an injury before, you don't exactly know if you're going to come out on top, and it's a fear that this injury is forever lasting and you'll never get better, and then the depression sets in, especially if the pain level is super severe and super high. Prime example is had a young man who's had back pain. The back pain started after lifting weights or something of that nature, and because the pain is so severe, came to me and he goes, "Do I need surgery?" And I go, "Well, I don't even know exactly what happened. You got to give me the whole story. I need to know your history. I need to know what happened over a period of time. Have you ever had back pain before? What exactly it is you do? What do you do on a regular basis? What have you done since the back pain has started?" So all of these things, I need to know what type of pain is it. Is sharp pain, aching pain, burning pain, shooting pain? Each one of these different kind of pains represents a different form or a different source of the pain or a different source of the injury. So I need to know these things. Typically whenever you have an injury, surgery is not the first thing you want to go towards, or the first thing you want to look towards. To be honest, if you had back pain, majority of back pain goes away without any kind of intervention, and that's just a fact. Most of the time your pain will go away. Unfortunately, it might return if you don't take the necessary interventions, but majority of pain goes away. Now, for that pain that returns or nags over a period of time, or is chronic, you definitely want to make sure that you do the necessary things towards getting you to your goal, which generally speaking is not having pain again, or to be able to perform the activities that you love to perform. So you definitely want to potentially, if it's a joint issue, you might want to go to see your physical therapist first. And most individuals don't know or don't realize that you can see a physical therapist initially, because most of the time when you have pain, you go to your doctor. And what's your doctor do? Your doctor sends you to your physical therapist. You can cut out that middleman and save yourself some time, and potentially start off your healing process a lot earlier if you go to see your physical therapist to begin with. So let's say, for instance, you do see your doctor. You go to your doctor says, "Okay, you've got back pain. All right, I'm going to give you some medication, but I'm also going to prescribe you or suggest that you go to see a physical therapist." Okay, no problem. You go to see a physical therapist to give them some time to try to figure out what the source of the injury is, and try to figure out the best course of action towards getting you your recovery, as well as teaching you how to maintain the goal that you have, which is no pain. Because it's one thing to get rid of the pain, but it's also something to keep the pain away. So I think that somebody who can help you achieve that is the best source of information, and the best type of individual to go to. If for some reason that the pain is not going away, or you're not getting any better, or the pain is getting worse, let's say, for instance, after 2 or 3 weeks of continuous treatment, and you following the protocol, actually, as well as your home exercise program, then you might need to step it up to the next level, potentially going to an orthopedic a doctor, or and if the orthopedic doctor is not able to help you, then they might send you to a neurologist, if the pain is neurological in nature. And then if they can't necessarily find out what the true reason is, then more than likely they're going to send you to a pain specialist, and they're going to shoot you up with whatever kind of forms of medication that there is. Try to hit it directly to the joint or to the nerve. And if none of those things work, then the last course of action would be surgical intervention. So you might have to go back to your orthopedic surgeon for that, if they deem it necessary, depending on what the MRI and so on and so forth might determine. And after you have the surgery, which is the last stop, you hope that you don't have to go to surgery. But if you do, you're probably going to need physical therapy afterwards in order to strengthen and build up so that you can return. Because to be frank, surgery is trauma. No way, no ifs, ands, or buts about it. They have to go through the muscle. They have to cut through the skin. They might have to cut through ligaments or whatever have you. And you have to heal back from that. So surgery is just controlled trauma. And you're going to have to heal back from that. So I'm going to need a therapist for post-surgical rehabilitation. And so I hope I was able to answer that particular question. I get asked very frequently, and usually from individuals who are extremely fearful of the pain and don't know what to do, and they have so many thoughts going through their mind. And I just hope I'm able to kind of ease any kind of fears that you might have, and hoping to help you guys have a better blessed day. All right, you guys have a good one. If any questions, always feel free to ask. All right, you guys have a great day. Bye-bye.